Good morning, everybody. Thank you for being here today. The doors have closed, so I am taking that as my cue to get started. My name's Lisa. I work at the University of Melbourne, but prior to that, I was a teacher in schools for about 25 years before I jumped ship into the university, which is purely accidental, and I blame Shirley Pode for that. Those of you who know Shirley, who went on secondment and called me in to take over her role for a couple of years, and then I never left. Certainly, I've been an external coach for PBS in Victoria, in the Southwest Vic region. Any people from that area here today? And so been doing a lot of work with PBS for quite a number of years, and I guess got interested in this whole idea of attendance, which is what I'm talking about today, through my work in my last school that I was working in, which was a hospital school called Travancore. So I'll tell you a little bit more about that story after I have acknowledged country. So I do want to acknowledge the unceded lands on which we are meeting and learning today. I would like to acknowledge elders past, present and emerging leaders, and really recognise that Indigenous peoples were the first teachers and continue to teach us every day. I also want to acknowledge the unceded lands that I live and work on, and that's the lands of the Wurundjeri Wurrung people of the Kulin Nations. I also want to pay my respect to any Aboriginal and Torres Strait Islander people who are joining us in our group today. So, I can't do this work on my own. And I am very privileged to be able to work with a lot of other people who are really passionate about this space of attendance. And I got into this attendance space really by accident. So I was working at Travancore School, one of our partners. And Travancore School is a school that it's attached to the CAM service in Melbourne, the Royal Children's Hospital CAM service, and Origin Health. So our young people, the young people in our school all have tertiary level mental health difficulties, and I was working in the outreach team. So I had the privilege of spending my days in other people's classrooms, working with them for young people who mainly had externalising behavioural difficulties. So my days were spent doing observations, developing FBAs, working with teachers to develop plans that would fit their context. And then sort of probably around 2010, so a while ago, we started getting these kids who weren't at school, but not because they were being excluded, but because they couldn't go to school. So, when we talked to families, they talked about significant distress that they had when the young person had to attend school. When we talked to the schools, they were saying, well, they turn up for about an hour in the morning and then they're really distressed and they go to sick bay and we call parents to come and get them. And so we started researching this thing called school refusal and realised that it was actually bigger. There were more people on our referral list than we had really understood this thing called school refusal. It's not a diagnosis. So we only ever found out about it when a clinician would say to us, well, they're just not going to school and we can't do anything to get them back to school. And so we thought, we can solve this. We're specialist teachers, we know our stuff, we're working with really highly skilled mental health clinicians. Read some stuff about how you get these kids back to school and thought, cool, we could do this. We failed dismally. Even with all the skills and things that we thought we had, we couldn't get these kids back to school. And so it's like, well, what do we do now? And that was when it was fortuitous that I got sent to the university and was able to access grant funding to say, what does this look like? How do we do things differently? What can we do to get young people to school? So that led us to creating a Tier 3 program called Into School. And anyone who was in the workshop I did yesterday, you would have seen a little bit about that. Into School is an intensive daily individualised program for kids who are school refusing. The original version was the first version. 6 months, we take the young people and we bring them into our transitional classroom, called that because they don't stay. do a lot of rapport building, start to build in social emotional learning, eventually curriculum, and then we get them back to school. So we trialled that and it worked. And we go, oh, this is good. They're going back to school and they're staying at school. Awesome. And these were young people who could have been out of school anywhere up to 2 years. And we were working with 11 to 15-year-olds. So that was our age group. So we go, all right, well, what will this look like in a different setting? So we replicated it with MacKillop Education, other partner. And MacKillop decided to take on a 2-year pilot with us, looking at what does interschool look like in an alternative school setting where the kids aren't coming from lots of different schools and coming to a classroom then going off to a lot of different schools. The students were MacKillop students, but they came to an interschool classroom at MacKillop. We realised that 6 months wasn't going to work in a school, of course, because you don't want to just transition kids back into classrooms after 6 months. So that program is 12 months. And then people started saying to us, well, what about the kids who, we can't do Tier 3? You know, we don't know what Tier 3, we don't have the resources to do this sort of program, so what else can we do? And that's when we got really interested in multi-tiered systems for attendance. So what does Tier 1 look like for attendance? What does Tier 2 look like for attendance? And how do we minimise the number of students who need re-engagement programs like Interschool? And I know it's not the only one in Australia. I know there are other engagement programs around. So that's where this project has taken off from. This idea that we need something different. We need prevention and early intervention, which isn't happening through business as usual systems. But we also need to think about how can we make this not an additional extra. Everything that Kent said this morning was just resonating with me. You know, we don't just want to keep adding to that stack. We need to say, what are we already doing that works for attendance and how might we tweak things to really have that focus? So that's where we're at. And I'm conscious I have you for 50 minutes, but if there are questions as we go in case I run out of time at the end, please just, shout out. So the other people that we work with are the Children's, of course, because that's our Travancore link. We work with University of Illinois, Chicago, Deakin, and there are 16 schools whose voices you will hear today, not all of them, some of them, who were our guinea pigs for this research. So I want to thank them as well. I think this is pretty telling of what one of the biggest learnings that came out of this project is. It's from a secondary school principal in our project. Our attendance work is now seen as an improvement process, not just monitoring. And I think that was a fairly similar story for a lot of our schools, is that they were monitoring attendance, focusing on chronic absenteeism, but not necessarily being active in that prevention and early intervention space. They thought they were, but when we drilled down, they weren't really. And so, to me, that's probably the best quote ever that you can get from a leader when you see that they've been able to make this shift. So the story from now is how did we get to this shift and what happened here? If you were in my workshop yesterday, some of these initial slides are similar to, or they're not similar, they are the same as yesterday, but it's really important I set context up for everyone, so feel free to have a little nap for a few minutes just while I get through this first bit. So, what do we know? The national school attendance problem, we know from a commission report, productivity report, pre-COVID, that school dropout is costing $70 billion per generation. That's quite a bit of money, okay? So these are young people who don't necessarily complete school, and there are long-term social, economic, and health outcomes. There are social outcomes with regards to adult relationships, higher levels of divorce, higher levels of family dysfunction. We know economically there is unemployment and underemployment in this group of young people. And we also know health-wise they're more likely to be accessing adult psychiatric services and also physical health services, physical health. So we know that the outcomes are not fabulous. Hence, prevention and early intervention. That 200,000 is, international estimates for school attendance problems is about 5% of kids will have school attendance problems. Percentages don't sometimes mean much until you put numbers to it. So 5% is 4 million kids in our schools, about 200,000. However, this vastly underestimates what our national data is telling us. 1.5 million kids are attending school less than 90% of the time. And 90% of the time is important because we know in this field that is when these outcomes, short and long term, start to manifest. Not for all kids, but they do for those kids who have problematic attendance. And by problematic attendance, what I mean is kids whose attendance means that they are having real trouble attending school. And that might be because they can't go to school, kids who are school refusing. It might be that they're home because their family needs them home as a carer or helping the finances, preventing family violence. It might be kids who find other things to do than be at school or be in the right place at school. Be that, connecting outside in the community, being home, online gaming, or young people who are not attending school because school's finding it really hard to manage them. So 1.5 million kids. Some of these students will not have problematic attendance. So they're the family that's taken their kids off for a 6-week holiday, and after that they come back to school and there's no problems, they keep attending. Now, not great, but not problematic when it comes to school attendance problems. The difficulty we have with this data is we actually don't know what the problem is. We know this is a 90% threshold, but we don't know how many of these young people have problematic attendance difficulties or unproblematic or non-problematic. So data is a big issue, and I'll talk more about data later and how our schools tried to overcome that and what they learned. You can also see that the blue there is Aboriginal and Torres Strait Islander youth, and the green and the red are remote schools and lowest ICSEA quartile. So you can find all this data on the ACARA website. They report the first half of the year every year. And certainly it's nice to see things are ticking up again, but we certainly haven't reached pre-COVID levels yet. So the program that we decided to have a go at trialling was to test this feasibility of an approach that looked at multi-tiered systems of support for attendance. And the focus really was on, firstly, building teacher and school capacity. So we really were interested in saying, what do schools need in order to do this work? We also wanted to make sure that they knew where to go for supports and what was available. And it's really tricky in Australia because we don't have a place where you can get resources. We don't have a central repository for attendance themed resources. I know that state and territory education authorities have their own repositories of information. And we certainly have international repositories like Attendance Works. So if anybody's not visited Attendance Works, it's a really great site, has lots of information on it. It's a US-based site. But we really don't have a national space for resources, and we really need to think about what works for the Australian context, because just because it's worked somewhere else doesn't mean it's worked here. You all know as PBL schools that you contextualise. Even when you get stuff off the US website, you change it up and make it work for you. We also needed to think about, can we make this sustainable? Because it's no use, like all programs, we get researchers come in, we do something, funding runs out, we walk away, and you hope that the school can continue going with it. And so that was another thing that we had to think about. What does sustainability look like? How can we make things part of a school's everyday work? And we really wanted to ensure that schools could contextualise so that it was theirs. So they looked at their population, they looked at their data, and they said, this is what we want to do. So that was the focus of the work that we were undertaking. Now, this is something everybody is used to seeing. We're all used to seeing the good old MTSS triangle with academics and behaviour. And we know, and something that I'm always working when I'm training teachers, particularly in behavioural interventions at the university, is really drilling that behavioural intervention is exactly the same as academic intervention. We teach explicitly, we give opportunities for practice, we give guided and independent practice, we do review, we allow them to make mistakes, we reteach. And we use, Kent talked about a lot this morning, what's the universal things that we do as PBL schools. We know that for some kids, Tier 1 resources or Tier 1 supports aren't going to work, so we need to think about what can we enhance or build on for those students. And we know for some students we need really intensive intervention. And behaviour, academics, doesn't matter, we can do all those things, and things that you are all very skilled in. Of course, we need to assess, we need to use our data, we need to screen, and we need to progress monitor as we do this work. So we were very excited to come across some researchers in the US who talk about this multi-tiered system of support that's actually multi-dimensional. And it makes perfect sense that why are we just thinking about academics and behaviour? Why is that all we look at? Shouldn't we be thinking about all the other things we do and how they can integrate together? How can we have an MTSS framework, so taking Kent's bike, add in a few more spokes or something. I don't know, I'd have to think through that metaphor a bit more. But we found researchers in the US, Chris Carney and Patricia Gracek, who had been doing, first time they wrote a book was back in 2014. They wrote a book about MTSS for attendance. Now back then they were really focused on looking at things like, RTI and PBS and attendance, sort of as separate yet connected, I guess, ideas. And saying, schools have been using these RTI and PBS models for many years, so why shouldn't we have that for attendance? And so we found this information and we got in touch with Patricia and Chris, and we sort of said, do you do this stuff anywhere? Do you just do it in the US? And found out that they, yes, have been doing it in the US, particularly in Chicago, hence our link to Chicago, but also in the Netherlands. They've been doing it for since before COVID. They've been doing this work in the Netherlands. So we had and Ireland. Ireland's the other place that there's this work being done. And we thought, well, okay, it's been done elsewhere. What does it look like for us? So we had the opportunity to get Patricia out and work with us, and that's sort of where this program came from. But it really is the idea that these things, while they're around the four sides of the pyramid, ultimately, if we're going to get this right, we have to bring everything together. We have to not do all these separate stack things. We need to say, what does integrated MTSS, multidimensional, look like in our schools? How can we do this using the tools and resources we already have, which we know are really stretched at this particular time in all education settings? So we were engaging with this scary triangle, which is what are the cut points or the cut scores or the thresholds that we know, based on the literature and the research, match the tiers that we're used to seeing. And I know that certainly the Victorian Education Department, we have our own guide to School's Guide to Attendance, and they use these particular thresholds, and I know that other state and territory authorities do use that as well. So let's have a look at these. So universal. Universal is for 80% of our young people. Universal in attendance is for students attending 95% or more of the time. So our young people have occasional absences generally come back to school, all good. So for those students, we would be using universal intervention or supports. Tier 2 is students who are attending 90 to 95% of the time. So 5 to 10% absence. They're our at-risk group of kids. So they're the students who really require that early intervention, whether that's enhanced Tier 1 supports or specific Tier 2 programming. And then Tier 3 is attending less than 90% of the time, so that ACARA threshold. And theoretically, that's 1 to 5% of the students that we have in our school systems. I'm wondering, how many people in the room, give me a thumbs up if you are, how many people in the room think that their Tier 3 threshold, the number of kids in their threshold, is more than 5%? Yeah, pretty much everybody. Does anybody think that they've got an 80% Tier 1? No. Yeah. Thank you for that. And that's certainly what we found when we worked with our schools, and I'll talk more about that as we go through. So this is the first challenge that we have for our schools. What does your data look like? And there were no triangles. There were no triangles. No triangles. So don't feel terrible. We had no triangles either. This is what we did with our schools. This is our research design. And the focus really was on, we only had funding for basically 6 months. So I do have to acknowledge our university. They gave me $20,000 and said, go forth and research. That doesn't go very much in research, particularly when you're hoping to get, schools coming in for workshops, catering, research assistant to help you manage it. So there was a lot of, a lot of goodwill with the people who were in our team who worked on this. So we started with workshops, and what I did yesterday for those people who weren't in the workshop is I took the participants through, or the attendees through, parts of the workshop that our schools went through. Today we're talking about what was the outcome. We had, so we contextualised the US training for our setting. We delivered the workshops. We have 2 workshops, one for primary and one for secondary. We had pre and post surveys. Then we had 6-week and 12-week coaching or check-in sessions with our schools. And we also got them to do more surveys. We had 2 schools who volunteered to be our case study schools, and we had extra time with them, and we were doing focus group research with them as well, so interviewing about what they were doing. So that the quotes you're going to see in the second half of the presentation are mainly from our case study schools, but also quotes from the qualitative data we collected through our check-in sessions. We got to December, and that was the end. We have still several schools this year who want to keep going on this, which is great. We just have to find a way to do it with them to continue the journey. Because every school, even though we had trouble getting their tiered data, because it was optional, it wasn't mandatory, certainly the feedback we got from schools is they were seeing improvements in their attendance data by December. And the few schools that sent us their tiered data were showing improvement as well. So we know that they were starting to see change, small change, but change. So who are our schools? I don't know if you can see it, but there's little dots on that green map, and they are where our schools came from. What's really great is we had metro and rural schools in our cohort, and that was really important because things that our metro schools might be able to access, our rural schools maybe couldn't. So when we had our coaching sessions where we brought 3 schools together to have a sort of a session together, they were able to hear from one another, and they were able to think about things that might work for them or problem solve around things that weren't working and getting feedback from the others. Because it's all well and good, myself and Glenn, who was my co-researcher, sitting in these sessions, but we're not in schools every day. So we really valued that opportunity for sharing and listening and learning as well with what our schools did. So as you can see, we had 7 secondary and 7 primary schools. That wasn't by design, that just happened, which was nice. We had schools, our smallest school had 82 students in it, and our biggest school had, I think, 1,800 students in it. So we had a big range of schools, sizes and types as well. We also had 2 special education settings. One was more primary focused, so they attended with the primary group. One was more secondary focused, they attended with the secondary group. We stipulated that we would only take schools who would send a team to the training, because one of our non-negotiables was the establishment of a school attendance team. So we had, anywhere between 3 and 5 people attending from the schools, which was fabulous. Firstly, because they were released by their school to do it. We couldn't provide them with CRT, replacement funds or anything. All we could do was feed them. But they turned up and we were really appreciative of that. You can see we had, quite a number of leaders, which was also really important, because when you're trialling something new, you need your leadership involved. So what did we find? Well, this is just the survey data, and I'll show you some graphs in a little bit, because you can't have a research presentation without a graph or two. But we've got, as we said, we did pre and post surveys before the workshop, after the workshop, so that was in a period of about 7 hours. 6-week surveys, 12-week surveys. Now, there was some attrition in the number of surveys that were completed, but we still, by the end at 12 weeks, still having 60% of our participants completing surveys. So that was pretty good, because usually attrition can be a bit worse than that. So what did they know? By 12 weeks, they felt they were confident in the skills they needed to implement an MTSS framework for attendance. Secondly, certainly after the workshop, they felt that what they'd learnt would be useful, which was good. They thought that this would create change. They certainly, it was really interesting, and I'll show you the graph. For some reason, even though we weren't targeting Tier 3, they felt they had an improvement in skills for targeting Tier 3. So I'm not quite sure whether that was a confidence thing. We haven't really unpacked why that happened, but okay, that's great, because they're the chronically absent group. And while workload and stress were substantial barriers at baseline, they've reduced by 12 weeks. So this is our barriers to implementation. So we felt it was really important we understood what we might have to target, particularly in coaching sessions, around barriers. And you can see here that these two, tolerable workload and tolerable stress, were our lowest rated ones. So black is baseline and blue is 12 weeks into implementation. So you can see at baseline, on the workshop day, when we gave them this survey and we said, what are going to be barriers for you? What are going to be the issues for you out in schools? They said our workload, and this adding to our workload, and they said the level of stress in our schools. We feel like they're going to be barriers to us. Then at 12 weeks, you can see they almost caught up to the others. So workload wasn't the barrier they thought it was using this model, and certainly wasn't as stressful as they perhaps thought it might be. So that was a real positive for us to see that. We only had buy-in and perception of need were asked at baseline. So we wanted to see how much buy-in we had and how much need there was. As you can see, there was a lot of buy-in and also a lot of need. But the last one, which is reported benefits, we only asked at the end, and that was pretty high. They felt like the benefits were there. There wasn't much change in leadership support or self-efficacy. They had real readiness at that point. They felt like their leaders were supporting them. They were at the workshops. So, that was there from the start. But I think that belief that they could do this, because what we were trying to present to them was not something that was in addition, but it was just enhancing what they already knew and probably was in place. I should also say our schools were All but 2 of our schools were PBL schools or SWPBS schools. One of the inclusion criteria was that you had to be involved in some form of MTSS implementation. So most of our schools were PBS schools, and a couple were RTI focused schools. So they had really embedded response to intervention rather than PBS. So we had that MTSS mindset coming in, and that always helps, of course, when you're not trying to convert people to thinking about frameworks in a different way. So that was our barriers that ended up not being the barriers we thought they would be. And it is a 0 to 6 scale, by the way, too. I haven't just cut the scale off to make it look better. It is a 0 to 6 scale with the higher being less barriers. Probably should be clear about that. This is application of skills. So the other thing that we tested, and you probably won't be able to see this very well, but I'll go through them, is there are a number of skills that we wanted to see if we could teach or we could improve with the teachers. The ones that I have circled, those 3 circled ones, are actually implementing school-wide preventative supports Tier 1 based on school data. So you can see that was an improvement. The red shows how much improvement. So the higher the red bar, the bigger the improvement, just to make that clear. Tier 2, improvement in Tier 2 intervention, and an improvement in Tier 3. Now, while we didn't actively focus on Tier 2 and Tier 3, in the workshop we did provide Tier 2 interventions that they might like to look at and Tier 3 interventions that schools could reasonably achieve as well. So we did do that, but we weren't focused on it, and we're really surprised when we got results that had them feeling like their skills had improved in these areas. So, fairly happy with that. The other things we were looking at was, could they define different types of school attendance problems? Because when you get to Tier 3, interventions change depending on the type of school attendance problem. So it's not a one-size-fits-all, particularly in Tier 2, particularly Tier 3 and a bit of Tier 2. They certainly were calculating the percentage of students in that tiered triangle every month. They were using group data to plan. We also talked to them about function-based school attendance problems. So Chris Kearney has developed a scale called the School Refusal Assessment Scale. It's freely available on the International Network for School Attendance website. And what it does is it looks at what is the function of the school attendance problem. Now, it's called the School Refusal Assessment Scale, but it's not about school refusal. Back in the day when this was created, school refusal behaviour was like an umbrella term for school refusal and truancy and school withdrawal. So there are 4 functions to school attendance problems. The first function is escape from negative affect, which basically means school is not a great place for me to be. I feel really sick when I think about going to school. I'm really worried about being at school. So that's kind of that function. The second function is escape from aversive situations. So if we think about good old behavioural functions, and we have escape, these are young people for whom being in particular situations at school is particularly worrying or stressful. So it might be having to get changed and go to phys ed. It might be, I've got to do a verbal presentation, an oral presentation today. It might be, we've got our music concert and I can't think of anything worse than getting up on stage and being in front of other people. So that was that function. The third function is gaining or seeking attention from significant others. So that links a little bit more to our school withdrawal idea, but also young people with separation anxiety. And then the fourth one is tangible reinforcement. So that's really, there are better things to do than be at school or be in class. And they're really oversimplified explanations, but you get what I mean. So what we asked them to do was to think about, could they learn about function? Does that make a difference to thinking about how they intervene? Certainly they were able to use these function-based approaches to think about intervention. Looking at health-related absenteeism and what you could do for that. Also, could they use school-wide indicators and data to make sense of what they were seeing with attendance? And really, did you know what to do if a student has been out of school for a while due to maybe health issues, mental health or physical health? Did you know how to plan for their return and what that looked like? And again, that knowledge increased. So, we were pretty excited to see such an increase in skills for such a short period of time that we got to work with them. So imagine what we could do if we had 12 months with our schools. So what do we do? And we're going to be hearing and some quotes or reading some quotes from teachers during this. We started by auditing. We need to audit practice. We need to review data, establish our teams and implement evidence-based intervention. So 4 kind of steps. So with our audit, what did we find? Well, we got our schools to, and people in the workshop yesterday did an audit. We did a school-based audit that looks at what are the areas, what are the gaps in our practice? What are we doing really well? What are the gaps in practice? So what we did with this is we got the schools to all audit their practice. And because they were all there in teams, it was really beneficial because different people in teams had different perceptions of what they thought was happening as well. So a classroom teacher maybe had a different perception to a leader in the school. So they got to come up and audit. And they realised that, and so we looked at, did they have a team? Because very often there was only one person or 2 people responsible for attendance in the school, even in the big schools. Did they have accurate data? Did they know how to tier their data? Were they promoting a culture of attendance? What did that look like? And what we found was that, particularly as staff capacity, all the focus was on chronic absenteeism, Tier 3 intervention, which we know is really hard for schools to do on their own. We also found that there was an assumption that the Tier 1 supports they had in place were working, and that takes us back to that quote from that principal right at the beginning. It was monitoring. That's what was happening. It was monitoring. But by the end, it was improvement, and that was a focus. So the schools said, we have a Tier 1 problem. We need to focus on prevention and early intervention, and also how do we integrate that with our PBL program? What does that look like? So our tiered attendance data, like I said, they wouldn't give it to us, but I don't know, I think that will work. I don't know what they thought we were going to do with it, but no, I understand. It was really sensitive, and it was really, for some surprising, for some shocking when they tiered their data. They really had no sense of how outside of the perfect world they were. One of the things we really had to stress with them was you can't expect to get to the perfect world in the short term anyway. This is a long-term project. So we had to really focus on, building self-efficacy and not having our schools feel like they weren't doing a great job. They were doing an amazing job. They just never looked at their data this way. They'd never looked at it this way before. So that's so surprising, shocking. So no school had more than 60% of kids in Tier 1. No school. They were most hovering around 50%. All schools reported coding error in their attendance data. So that was parental coding or family caregiver and teacher coding. Lots of errors. They actually didn't have straightforward systems for tiering their data. In Victoria, we don't have a statewide data collection system in Victoria. There are 3 different programs a school can choose to use, and none of them measure the same thing, which is a little bit of a difficulty. There was certainly an identification of stigma for parents and students with disability, certainly because of the NCCD. Some of the schools actually tracked their NCCD, the kids on their NCCD list against absence or attendance, and noticed that, greater absence for those kids. One of our primary school leaders noted this, and this was really telling about what we found when we started working with data. So they couldn't determine what the problem was. They just were working on percentage absent. So once they tiered their data, and I like how he said it's taken 3/4 of the year, but we didn't start working with them till August, but that's okay, 3/4 of that period to try and get the coding right. And then they knew they had a tier 1 problem. They knew by the workshop they had a tier 1 problem, but it was really confirmed once they got back. We taught them how to tier their data as part of the workshop, and some schools were able to do it then and some schools did it when they got back. But really, they were really surprised with the number of errors too when they started drilling down into their data. And it's really hard to make data-based decisions if your data's not accurate and reflecting what's happening for you. So that was one thing we noticed. This principal talked about the fact that the data they were getting from region and the data they had didn't match. So that was really problematic for them, and certainly talked about they were confused because they get data from the department outlining which students they should be focusing on with attendance, but it actually didn't match their school-based data once they cleaned and worked with the data that they had. So I think, again, that's really telling, how do systems speak to each other? How does the school speak to the broader system? And how can we ensure that those things are aligned and what the schools are working with is accurate and makes sense for them? So I think that was really important, that review. So it highlighted the problems. We certainly also found that if they wanted to use certain interventions like nudge letters at Tier 2, that they had to manually graph data to put into letters. There was all sorts of things that they came up against. They also, a couple of our schools were working with one particular provider and they tried contacting that provider for support and had no response, or were told it would cost you this much money, and they didn't have the funds to do that. So it's like, well, we'll come up with our own systems. And that was something certainly I've seen in the US schools who are much further down the track, is the way that they work with their data, the way their data systems are set up is just phenomenal. It's just amazing what they have access to. And it's also publicly available, which is interesting. So then we had to say, well, how does this work with what you're already doing? What are the realistic goals that we can put in place with the work that you do? So certainly whole school and whole class supports, Tier 1, that was our focus. That was what we wanted to focus on particularly. Culturally safe environments. And certainly when you talk to young people who are chronically absent, they often tell you they don't feel safe or they don't belong. They don't feel like they belong. So what does culturally safe look like for you and your school? The alignment with PBL interventions was really important for us because it went back to that workload and that worry about workload barriers. So what does that look like? Well, they did things like updated their expectations matrices so that they had attendance-specific behaviour, which they then taught. Certainly things like, what do you do when you come to class late? What's your entry routine look like? How do we teach that? What is it for our particular school? They certainly focused on improved attendance. It's one of the things I haven't spoken about. We often look at regular attendance rather than improved attendance. When your tiers are so out of whack, focusing on improved attendance can actually be a lot more powerful. So how do we celebrate improved attendance in our classes or individually for our young people and their families? So there was a focus on what does improved look like, how do we celebrate that? So it fitted within the incentive programs they already had for PBL. And their integration with PBS, as I said here, was around being in the right place at the right time was an example of a behaviour that one of the schools came up with. Improved recognition processes, and those other things. And one school decided it was going to update its major-minor behaviour flow chart for attendance, to add attendance in. What happens if a young person is late, etc. So what they did, some schools chose to have a separate school attendance team. So they just decided, we've got these people who came to the workshop, these are our school attendance teams. Others, as they went through the coaching process, realised that a separate team wasn't working because the same kids were turning up in the PBS discussions about, who was at school, so behavioural stuff, particularly around truancy. And there were others who decided that academics, kids who were absent, were also turning up in academic data. So some schools created a combined team. So not all of our schools did, some chose to keep it separate, but we did have, particularly some of the larger schools, would have a centralised MTSS team, and then they would bring different people in depending on different discussions. So in a big secondary school, they would have a central MTSS team, but then if they were talking about the year 7s and 8s, they would bring in the year 7 and 8 coordinator for that particular meeting to talk about this particular group of students and that sort of thing. So we have flexibility in that. I mean, if in a perfect world, I would suggest that you have one team that manages all of your MTSS and then brings people in as needed. That would be my thing. All right, so let's talk about this group of students, this school. Example of a PBL intervention that made a difference to attendance. So this school was averaging in semester 1, 60 unmarked roles per day. And I will never name the school, but they knew it was a problem. They just didn't know what to do about it. And it was teacher error. It was teachers not marking the role, or it was subs in who, or CRTs in who didn't mark the role. You know, they identified there were issues. So their attendance data was inaccurate. They weren't identifying people early enough, and their school attendance team identified this as a Tier 1 problem. So they said, what can we do? And they made a decision that, this was a big rural school, that's as close as I'm going to get to the school, instituted greetings at the door, lining up at the door. They'd not had it before, and they went, right, we're going to try it. So it came down from leadership. This is one of our PBL activities. We are now having an expectation that we all line up at the door. And what happens, the teacher was asked to greet every student and mark the roll as the student entered the classroom. That was the rule. So by November, 0 unmarked rolls firstly. Secondly, they'd set up a system. So if a student was in a class and then not in another class, they managed to get they were checking in and getting an alert. I don't know how they did it. And so they could go and find that student and find out where they were and get them back. They put the resources into that. The teachers who were coming to our check-in session said, and we realise that we feel like our relationships with our students are improving and kids are coming to class. They also had, because of the system they were using, they had a green bar, like teachers could see the system. There was a green square if the roll was marked and an orange square if the roll wasn't marked. So there was also this sort of peer kind of check-in going on because the teachers could see who hadn't marked the roll. They were paying attention to this. So they knew if something wasn't marked, then they could ask questions about that later. Why, was there a problem you couldn't access the system? You know, it wasn't a blame thing. It was a curious questioning problem solving. So simple PBS works for attendance. The other thing was focusing on parents and caregivers. When we drilled into data, we found a really big reason for absence was appointments. And maybe you see that too in your systems. So we, particularly finding kids on NDIS plans, were absent because they were going to appointments with allied health or other supports that they had. And so schools, lots of schools talked about this, so the coaching sessions were really good for them to get ideas. And I'm conscious I have to finish in like 2 minutes. So they were educating families and really focusing on trying to work with families, particularly in SSGs, to talk about can they find other times for appointments. So can you go to an appointment at the end of the day? Can you go to an appointment at the beginning? Because they were finding that kids were going to an appointment at the beginning of the day and just not coming to school. Or they had an appointment at the very end of the day but were going home at lunchtime. You know, so there was lots of missed things. We found that particularly, and some schools had enough ability to create space in their setting for providers to come on site. Okay, so there was that option as well. But with barriers, there were not available appointments outside of school hours. That was a big problem with providers. that getting kids back to school, families transporting them back to school was a barrier, and student reluctance to return to school because you didn't have a culture of it's okay to come in, you know, and we just want you here, we don't care how you do it. That had to be worked on. So they were the issues that we found. Certainly we know in the US they're problem solved because they're really well established and they have communities who their outreach people go out and talk to providers and say, can you run a Saturday clinic? We will have our kids, they'll be there. You know, so there are ways around it, we're just not at that point yet. And just to finish off, I'll leave you with this. This is one of our primary school principals who talked about, you know, it was a new frontier for him and his school because it's responsive and, you know, they want to be one of the first schools in their network to use it and have a positive impact, which I thought was a really great way to finish today. So that is my time up. Thank you so much for being here. I'm here all week, as they say. Feel free to catch me during lunch if you've got any questions. One day we hope to get more funding so that we can roll this out more broadly. So, you know, who knows where it'll go from here. So thanks for being here.